Beyond the Pelvis is hosted by Dr. Keneal Siegel, a pelvic floor PT and intuitive healer, and Laura Haraka, a somatic practitioner and breathwork facilitator. Each week, we explore alternative and holistic approaches to healing chronic pelvic pain and other painful or chronic conditions. Join us and other experts in mind, body, and spiritual healing as we discuss a wealth of modalities ranging from ancient practices to modern therapies that challenge the conventional Western model of treatment. Let's get right to it. Welcome back to another episode of Beyond the Pelvis. Today, we are privileged to have Dr. Don Stracks. Dr. Stracks is an integrative physician who specializes in chronic health conditions that haven't been helped through conventional Western medicine. He's particularly interested in helping people make the mind-body connection as the way to heal chronic pain. He left his hospital practice in 2017 to co-found what is now Cormendi Health with his wife, Lisa. He now works with clients all over the globe through individual sessions, classes, and discussion groups to help them find healing. And Dr. Stracks, welcome. So nice to have you.
Nice to be here.
Yeah, and would you mind sharing a little bit more about how you actually ended up in the mind-body space?
How long do you have?
We got some time, but briefly, like how did it happen? How did it evolve?
So I graduated from college a long time ago now, 1991, and I went to work in a social work type position in inner city Chicago and did that for a couple of years and then switched and worked in the child welfare world for a little bit. And sort of had this idea that I might go back to medical school at some point, but I'd never taken any science classes. I didn't really know anything about medicine. And so I sort of slowly worked my way back, took some classes at night, took biology, organic chemistry, and eventually made the decision to go back to med school. And around that time, actually fell down a flight of stairs in downtown Chicago. And it seemed to be okay, but a couple months later, I started having these strange symptoms, like I would drag my foot behind me and started getting these shooting pains in my hands and my feet, and went to all kinds of different conventional practitioners and alternative practitioners, and everybody told me they knew what it was, but nobody helped at all. And like 9 months later, I was at a cocktail party. And a friend of mine was talking about his back pain, and he had read this book and gone and seen this guy in New York who explained to him the nature of pain, and he was totally out of pain. I remember him saying that it started, he was hanging upside down from his anti-gravity boots in his basement trying to stretch out his back. It's like, it's got to be a better way. But anyway, so it was Dr. Sarno, who's since passed away, but a mentor of mine from New York, and I was listening to the conversation, and we were talking to a third friend who had thrown out his back, and I'm thinking like, I've actually read that book before, and I understand the concept, but I had sort of forgotten about it, and it hadn't thought it applied to me because I wasn't having back pain. So I went home from the cocktail party and got the book off my shelf and reread it that night. I was like, oh, too much stress.
Oh, wow.
And so the next day I went to work and I came home and I dusted my bicycle off in the basement and put air in the tires and went out to the lakefront bike path in Chicago. And I rode my bike for like an hour, and it was just excruciatingly painful, but I kept reminding myself like I wasn't broken, I wasn't sick. And after like 45 minutes, it's just started to calm down. And over the next several months, I got better. And then I went to medical school. So I vowed that I would always ask people about stress and help people understand the mind-body connection and do everything I could to work in that world. So that's how it got started.
Yeah, it's so great that you went into medical school with this mindset already, because that's so key than figuring it out later or stumbling upon it by accident.
Yeah.
I could just imagine you've helped a lot of people having gone in with this mindset already in medical school.
Going in with that mindset was super helpful. It was more challenging than I would have thought. Like literally, literally the first day I ever saw a live patient. And so first 2 years are in the classroom, second 2 years are in in the hospital. And so very first day in the hospital, there was somebody in the emergency room with back pain. And I had made a vow to myself that I would always ask somebody with back pain if there's anything stressful going on in their lives. And so I asked her, and she was like, well, I mean, now that you mention it, I called my boss a racist this morning, and I think I'm going to get fired tomorrow. I was like, okay. And so we talked about that for a while. And so I went back to tell the attending physician what I had found, and he just stared at me for like 30 seconds. And finally, he's like, did you order the MRI or did you not order the MRI? And I was like, oh, it's not going to be so easy.
So interesting. I've went to so many doctors over the course of my healing from pelvic pain. And when I healed, I actually contacted many of them to go back, and I offered to share my story for free, talk about the mind body connection, and I was kind of just blown off.
Mhm.
So it's so nice to have doctors that already have this mindset already.
Yeah. Yeah.
And, we talk a lot about back pain. We have Dr. Sarno's book, and healing back pain. But I'm just curious if you could talk a little bit about some other conditions,
Mm.
specifically pelvic pain and different types of pelvic pain, and also maybe other things like migraines, depression, and anxiety. Did they all fall under that umbrella as well?
How long do we have?
I know,
It,
right?
so in my mind, right, I don't discriminate like certain types of pain are this and other types of pain are that. And what I will frequently say to patients, and I'll say now, is that until we learn differently, we assume that pain means something in our body is damaged. And the medical system works on that model. If you have back pain, if you have pelvic pain, if you have a migraine headache, you're going to go in and the practitioner is going to say to you like, oh, well, you're not feeling well, something must be wrong, let's try to figure out what it is. And sometimes they'll say like, oh, the something that's wrong is that you just don't have enough tryptophan in your system to prevent the migraines, and so we'll give you medication. Other times they might say, oh, you seem to have a slip disc or you have a bladder infection. But rarely is anybody going to ask, like, what's going on in your life? What happened at work this morning that might be stressful? And the idea that pain means damage is intuitive, right? When we're little and we fall down and we skin our knee, like you can see the blood and you know it hurts. And so you just assume, like, oh, that's why pain happens. But it's really an outdated model of pain. And so the research over the past probably half century doesn't support that. But pain has got to mean something, right? It's not just random. And the best model that I know of is that pain doesn't mean that there's damage going on. Pain means that the brain is sensing danger. And pain can be an appropriate response to the sense of danger. And danger takes all kinds of forms. And so I'll frequently say, like, sometimes it's a physical form. If we finish this podcast and I hop down off this chair and go and fall and break my leg, hopefully I won't call you guys and you'll say, oh, Dr. Stracks, just meditate for an hour. Like everything will be fine, right? I want to go and I want to get medical attention for that. But my experience has been that that's true a minority of the time for people. Oftentimes it's not a physical danger. That's the problem. It's an emotional danger, a relational danger, or a traumatic event, or a stressful event that's coming up. And so in certain situations, our brains can respond by producing pain in our body. And so when I'm seeing people who aren't feeling well, that's how I'm trying to think about it. Where's the danger coming from? And what can we do to reduce the sense of danger? And oftentimes that will help the pain get better. And so I've got a patient who had terrible pelvic pain and frequently still to this day will talk one-on-one with my patients who are not doing well to tell her story. But she was having an affair and was feeling guilty about it and decided that she needed to stop the affair. But the only way that she could get into a place where she had the power to do that was to have the pain get so bad that she realized like it just wasn't the right thing and she needed to do something differently. And so it was her body's way of trying to send a message and to protect her. And then once she sorted that all out, and it was complicated, right? And she talked with a therapist for a long time and did a lot of work to repair the marriage. But it wasn't a bladder infection. It wasn't pudendal neuralgia. It wasn't any of the diagnoses that she had been told it was. It was her trying to figure out how she wanted to live her life in the most authentic way possible. And once she was able to do that, she got better, and she's been better for over a decade. Um, I had another patient who I still see. She was one of the first patients I ever saw to talk about this. She came in for back pain, but she told me a story that day about how she used to get frequent bladder infections. And she went to a variety of practitioners, and everybody thought they could fix it, but nobody could. And finally, she said she went and saw this one urologist who listened to the story and checked her records, and finally said to her, he was like, I don't know how to tell you this, but every time you get mad, you get a bladder infection. And she said that he literally braced himself because he thought she was going to hit him. And her being her, she was like, oh, that makes so much sense. And so I think men and women, we store a lot of our emotions in our pelvis. And for a lot of us, emotions are really difficult. And so we have to figure out, like, what do we do when we're mad if we don't want to feel like we've got an infection? And I tell the story where I went down to a family party. I live in Chicago. I went down to Kentucky for a family party, and my father, bless his soul, he passed away a number of years ago, but he was the opposite political leanings that I was, and he had fallen and chipped a vertebrae in his back, and so he couldn't drive. And so like we all piled in, like me and my wife and my young kids, my mom and my dad, and like we rented this minivan and drove down to Kentucky. And we were pretty good about not talking politics until like the last half hour. And so it was pretty charged by the time we got there. So we checked in the hotel and we got the kids ready for bed. We fed them, put them to bed. And I went to the bathroom and it was burning. And so I came out of the bathroom. I said to my wife, like, I got to go to the emergency room. I've got a bladder infection. And she was like, A, guys don't really get bladder infections. And B, that's not usually what happens to you. Like, is there something going on? Are you mad? I was like, what would I be mad about? Just having taken this 5-hour trip with my father, talking politics, all trying to sort of explain and work it out. And I was like, what's to be mad about? And so I actually left the room and went behind the hotel and just like let out this primal scream and came back and I was fine. And so it's a way even that I will hold on to feelings, and then those feelings need a release somehow. And so that's one of the things, right? It's not always that quick, and I've been doing this for a long time, but it's one of the things that I will talk about with people when I see them in my office. I think migraine headaches are another really good example. We've got on our videocast series, we've got a number of patients with migraine headaches who talked about how they don't have them anymore. But when somebody comes in with migraines, we'll talk about how our subconscious will talk to us, just not in English. And it's this ugly migraine language. And if we can understand that the migraines aren't random, that there's information in them, and if we can lean into them rather than push them away, which is what everybody tells us to do, then we can learn a lot. And so one of my patients who's done really, really well over the years, she said when she was first learning about this, she talked with me and she read a little bit. And a couple of weeks later, she got on a plane to go to South America. And she had a really bad migraine. And she remembered me or somebody else saying, you should ask the migraine what it's doing there when it's there. So she said the plane took off and she turned off the overhead light and she got a blanket. She wrapped herself up and she closed her eyes. And she said, migraine, hey, what are you doing here? And she said she was shocked that not only was there an answer, but there was a clear answer about why it was there. And the process of doing that, just being curious, decreased the severity of the migraine by 50% just by leaning in rather than trying to push away. And I've heard multiple versions of that story with migraines over the years, and a number of people who had them every single day or 200 times a year who essentially don't deal with them anymore. And if they start to feel like a migraine, they ask a version of that question, like, hey, what's my body trying to tell me? And then they interpret that and work it out, and they don't deal with the pain anymore.
Okay, I have a question about the migraines.
Sure.
Are all migraines mind-body related or emotion related or something that's being suppressed?
Yeah, it's a good question. I had a patient just the other day, actually, who is learning about this concept and doing fairly well. Like it's been a couple of months and the migraines are already decreasing in intensity and frequency. And for her, the migraines are always related to her menstrual cycle. And so always in the middle of the cycle around the time of ovulation. And so what we talked about, and I think what made a lot of sense to her, is that over time, this pattern has developed where like she feels the shift in her hormones that happens when she ovulates. And initially that was probably associated with a migraine for one reason or another. And so now her body's come to expect that. And so she feels the shift and then responds in a way that produces the pain. It's not, in my mind, and I think in her mind, it's not the hormonal shift that's the problem. And it's the reaction to the hormonal shift. And so as soon as she feels it, she starts to brace and thinks, okay, here's it comes again. Like, what am I gonna have to cancel? What am I gonna have to do with my schedule? Who's gonna take care of the kids? Well, I've got this migraine. Where's my medication? Or if I don't get it, then it's gonna last even longer. And so as she's learning about this, I think what's going to happen is that she's still going to be able to sense the shift in hormones because she's sensitive and she can read her body. But she's going to have new skills so that those shifts aren't going to turn in to a migraine. And so yes, there's a physiological issue going on, but I think the pain and the suffering is oftentimes related to what's going on in our lives and our feelings and our thoughts, and not just the physiology of our body.
There's so much that can be applied to that. Just what you said,
Yeah.
the expectation or the
Yep.
anticipation
Yep.
of pain. Now, you've brought it up a few times.
Mhm.
Who is doing the answering, right? When they ask, hey, migraine, who's
Mhm.
actually speaking? Is it
Mhm.
body? Is it the migraine? Is it their spirit, their soul?
Mhm.
Like,
Mhm.
what are
Yeah.
your thoughts?
It's a good question, right? And so, who are we as human beings? And I know you guys are interested in the spiritual aspect of healing too, but we've always been spiritual beings for a whole variety of reasons. And so we look as the human race, right? We look to get into places where we can get information other than from the usual sources. And so in this day and age, right, we normally think that anything that we can read or find on the internet or listen to on a podcast, like that's where we get it. And so we're not as good at trusting our intuition or those still small voices or the hunches that we get that help us to understand what's going on. I remember when I was a medical resident, so back in Michigan, I was on a panel one time about spirituality in medicine and talked about a patient who I saw. I came in, like we switched services, and so I came in as the chief resident, somebody else came out, and we walked into a patient's room who was there with abdominal pain, and we couldn't quite figure out what was going on. And I just walked in the room. I was like, there's something really not good is going on. And I couldn't articulate it better than that. So it's sort of an interesting story. And we eventually sent him home. He recurred, came back. They did a barium X-ray and found a big tumor in his colon. And so then he got the treatment that he needed for colon cancer. And so the discussion was about, like, was it helpful that I had this intuition as a physician, even if I then couldn't translate that into the medical ease. And it was interesting. Half of the room was like, no, it's really good that we need to be able to trust that. The other half of the room was like, no, if you can't express it in the scientific terms, then it doesn't matter. I'm on this side, not that side. And, we could argue about it, but I think those things do matter. I think that there's lots of ways to take information, lots of ways to know things. And I think as clinicians, we'd probably all be better off if we gave more credence to the softer side that we know information. And I think that as practitioners and as healers, we know a lot, even if we can't always put it into scientific terms. And so when people are quieting down and asking the migraine what's going on, we're tapping into the spiritual side of ourselves. And I've heard people say that like health crises are the spiritual journeys of the 21st century, because we get into these places where like all of a sudden things are not what we thought they were, and we need to call on different resources and different parts of ourselves than we're used to calling into. And so I know a lot of people who had major health crises that have fundamentally changed like who they are, how they interact with themselves, how they interact with people around them. And so the process of being ill and the process of connecting with our spirit and our illness is really, I would think, about connecting in ways that humans have always done, but we don't always do in the 21st century.
Well, that's basically what happened to me.
Mm-hmm.
I
Yeah.
had a chronic pain condition. I had pelvic pain, specifically PGAD,
Yeah.
and I have completely changed through this journey who I am. And I just want to backtrack for one moment because I think it's really interesting when we brought up hormones. I spoke to Dr. Becca Kennedy at the conference in
Yep.
Colorado, and I am 53 years old. I do not get a menstrual cycle anymore. And I have had maybe or very few symptoms of menopause.
Mm-hmm. Mm-hmm.
And it's only when I talk about it or bring it up that I might get a little bit of a hot flash. And I have to say to myself, no, you're fine. You're
Mm-hmm.
good. And it's just so interesting that I'm sure I've had hormonal shifts happening in my body,
Sure.
yet I've hardly had any symptoms of menopause at all.
Mm-hmm. Mm-hmm.
And, I'm just interested. I saw on your website as well your work on or with intuitive eating, sorry,
Mm-hmm.
and celiac disease. So
Mm-hmm.
I'm just wondering if you could just talk about that for a moment. Is celiac a mind body or is it a combination?
That's a good question. So I have a number of different aspects of my practice, and a lot of it is the mind-body medicine side, which is really more of a psychological focus than a medical focus. And we have 4 psychotherapists on our staff and a physician's assistant who does a lot of psychological work with people. And there's also a more medical side of the practice. And the medical side is a lot of integrative endocrinology. And I manage thyroid medication for a lot of people. I actually do a fair amount of hormone replacement therapy for women because I do find it helpful in menopause. And I more or less learned to do that because I realized that it was helpful for some people. And most physicians weren't interested in knowing about it or learning about it once the women's health study results came out in 2003. And so the idea has mostly been menopause, you just learn to deal with it and do whatever you can or take an antidepressant. But I have found for a lot of women that balancing hormones works really well. The most dramatic story I have of that is when I worked in the hospital, this was probably 10, 12 years ago. A woman came in and she sobbed. Like, it wasn't crying, she sobbed for 45 minutes. That was the entire intake appointment, was just her sobbing. And at the end of the appointment, she was in her early 50s. I was like, here's a prescription for hormones. Why don't you fill this? She came back 3 weeks later and said, oh, thanks. I feel so much better. And so that's not everybody's story, but I've seen it enough that I know that it can be really helpful. Celiac disease. So celiac disease is clearly an autoimmune medical condition. And I would not treat celiac disease itself as purely a mind-body issue. Um, and I've seen people who are pretty sick with celiac disease, and it makes a big difference once they take gluten out of their system. I see a lot of people, including myself, who feel better when they don't eat gluten, even if they don't have celiac disease. And so this recognized entity of non-celiac gluten sensitivity, which that's been in the language for probably about 10 years now. And, is it in our minds? Is it in our bodies? Is it a combination? It's hard to know. My experience, and so here's an interesting story again, if we have some time. So we moved back to Chicago in 2009. I finished residency. We moved back here so I could work at Northwestern Hospital. And we had a 1-year-old and a 5-year-old at the time. And our 1-year-old had an asthma attack. He had just turned 2, I guess, and he had an asthma attack, which nobody in the family has asthma, and we didn't understand that. And so we took him to the emergency room or the pediatrician, and he got some steroids, and I was like, oh, he'll be fine. It then happened 6 more times in the next year. Every other month, he would get sick, he'd have an asthma attack, he'd get on steroids. And I was like, what is going on? And so one night, middle of the night, I was lying in bed. I was like, pollution? Could it be pollution? And so I picked up my phone and I searched, and it turned out we were living in the second most polluted zip code in the entire city of Chicago. And so I did a little bit more research, and it turned out there's a coal-fired power plant in our zip code. And so the next morning I got up, I was like, what is this? So I walked out my back door and I was like, that's a coal-fired power plant. And it was like a block away from us. I had no idea what it was. We were living in a part of the city where there are a number of rail lines and a number of highways as well. So sort of all the exhaust from all of that centered there. And I think the power plant was the main issue. And so I decided we needed to leave the zip code. And so I told that to his pulmonologist, the pediatric pulmonologist, who said, oh, that never helps. Like, moving never helps. I was like, okay. And we had just signed a year lease too. We had moved into another place in the same neighborhood. And so we spent the next 9 or 10 months, and we ended up with getting a lucky apartment right on the lakefront of the very north part of Chicago. It was the cleanest zip code that I could find in the city. And within like 6 weeks, he was 90% better. Like, it was crazy. And then a couple of years later, our 18-year-old cat died, and he got the rest of the way better. But I consider that one of my greatest integrative medicine healing journeys that I've ever done, because it's, the pulmonologist didn't recognize, said, yeah, kids grow out of it. But like, he needed to be out of that pollution, and it was not good for him. So I bring all that up to say that being a good integrative medicine physician, we also changed our diet around that time. So we put him on some supplements, we took out gluten, we took out dairy. I think the no dairy probably helped him some. The gluten didn't seem to make a difference. But our 6-year-old stopped talking about being tired. Like, 6-year-olds shouldn't be tired, and she was always talking about being tired. And she stopped saying that she was tired so regularly. And then a couple months later, I was like, you know what? I'm not falling asleep in church every Sunday. And so the way I describe it is that not eating gluten for me gives me this 5th gear that I had never known that I had over the course of my life. And I don't feel well when I eat gluten, so I don't. And if I do, I'm invariably in bed by like 8 o'clock at night. Like, I just can't keep my eyes open. And so it creates this energetic drag on me that I don't like. And so I don't eat it. Like, would I be okay if I did? Probably. But I do think that there's a physiological reaction in my system that's just not worth it for me. And so that's why I don't eat gluten. I also, frequently, with some regularity, will see people in my office who have taken out like every food that they've ever eaten. And so it's gluten and dairy and soy and corn and red dye and that I think starts to cross over a little bit into more of the beliefs. And so if I see people with extraordinarily restricted diets, we will start to talk about the expectations and the function of the brain and try to help them to bring some foods back into their system. It's hard though, right? People really feel like the foods are the problem, and it takes a while to help people understand that there's a role of the brain in addition to the role of the gut.
So it sounds like it's a very holistic whole body approach. And it's really just like looking at the body and the person in front of you, like you had such differences between your two kids. One, gluten was not okay, and the other one, it was helpful and useful. So it's really about like listening to our bodies and increasing. You had brought up one of your patients being really sensitive, and it sounds like it's just about improving for each of us our own sensitivity so that we can listen to our body, because our bodies will tell us what's wrong before our minds can figure it out. So how do you help someone with being able to listen to their body more, or increasing their sensitivity to notice when there's been a shift?
Right. The literature on highly sensitive people says that like 20% of the population is more sensitive than the other 80%. In
That's
my
like,
practice, it's like 99%. Like if
wow.
somebody's coming to see me, I just assume that they are highly sensitive. A lot of your listeners probably are as well, which makes me actually question whether that 20% is accurate and whether it's actually much higher percentage of the population whose
I
system.
wonder. I also wonder if more people today are more sensitive than in the past when they did all those studies. Just because, I don't know, I feel like we're here to change things up a little bit, because
Yeah.
I am sensitive. Most of my friends are very sensitive.
Mhm.
Everybody in my family is sensitive. So it's like, do I know anyone that's not?
Yeah, I think we talked about at one point making the tagline of Cormendi, medicine for sensitive people by sensitive people. Uh,
Oh,
maybe we'll do that someday. But it, we've all learned in this medical system that the answer is medication. And I have had talks with physician colleagues who have said to me, they're like, I don't understand. If I didn't prescribe a medication, what would I do? And so physicians have been conditioned to think that the practice of medicine is just about prescribing medications or doing procedures. And I think as patients, we've all been conditioned to understand that as medicine. And so we don't go to a doctor at this point really to have them listen to our story. We go to get a prescription. And I like to say that I think medication should be a last resort only, and I try to hold to that. And so when somebody comes in to talk with me, we've set it up. I have 60 minutes to talk to new patients. And so that's a long time. Sometimes it's not nearly long enough, but it's a long time. And so I get a chance to hear the whole story. I get a chance to hear what's going on with them, what's happened in the past, what their background is. And all of that, I think, relates to the condition that they're dealing with at that moment. And so one of the things that I'm trying to explain to people is that disease doesn't just mean that you're lacking the right medication. And so let's look at all of it: who you are, who your parents were, what your genetics are, what your experiences are, what you're eating, who you're hanging out with, the role of the emotions. And then we can try to get a better sense of what's causing the disease. The Psychophysiological Disorders Association that we just were at the conference in Colorado, they did a couple of online conferences. And so I interviewed Rob Munson, who was at the conference this year, who struggled with repetitive strain injury for 20 years, 30 years, long time before he recognized that it was about stress. And one of the big issues for him is that his mother died when he was 12. And a lot of the pain started several years after that, but I think a lot of it related to the loss of his mother. And at some point in the interview that we recorded, I said to him, how in this 20-year journey of trying to deal with this, how many people asked you about the role that your mother's dying played for you? And he stared at me. He's like, nobody. Like, it was a ridiculous question even to ask in this system. Dr. David Clark right? He's got this story. And so he wrote They Can't Find Anything Wrong and was the chair of the conference. So he's got the story about how he got referred a patient who had abdominal pain. They couldn't sort it out. And he talked with the patient, and it turned out she was in an abusive relationship. And they got social work involved, and she got out of the relationship, and the pain went away. And he wrote a note back to the referring physician saying, this is what we found, and this is what happened, and here's the outcome. And the referring physician sent a message back to him saying, oh, I'm glad that worked out. He said, it's reassuring to me to know that I didn't miss anything important. And so he didn't miss anything important. If you think your role as a physician is just to look at the anatomy, but if you understand your role as a healer, he missed the very most important part of the story. And so that's what we have to be able to change in order to make this healthcare system work better for people, is to look at the whole picture and understand that it all fits together and comes out in our body, and not just limit ourselves to looking at the role of a specific joint and a specific body part.
So when I had chronic pain, one of the things I did was retreated. I spent a lot of time by myself in my room, and I had a lot of, deep depression and anxiety. So I was wondering if you could talk for a little bit just about the role of loneliness in chronic pain.
It's certainly substantial. That was my experience too. In those 9 months back 25 years ago, it really became my whole world. And like I didn't go out, I didn't talk with other people. I just spent all my time trying to figure out what was wrong and what was going on. And I think sort of didn't recognize until I started to pull out of it how isolated I had become. And I think the whole experience of being sick is tremendously isolating for people. And, as one result, partly serendipitously, partly because of that, I've always done some of my work with groups of people. And so starting with working with Dr. Howard Schubiner in Michigan when I was a medical resident, and then moving back to Chicago, there's always been a group component of what I do. And I hear over and over and over from people how wonderful it is to be able to talk and connect with people who understand what they're doing, both trying to move forward through this mind-body lens, but also just to have other people who understand what this experience is like. And there's a textbook of group medical visits that was written a number of years ago. And so what I do is probably a version of that. But the author comments in the book that their group medical visits was a practice in Colorado that did a lot of this, probably in the 2010s, and said that the groups for fibromyalgia were so effective that he had come to the conclusion that trying to treat fibromyalgia individually in somebody is completely the wrong paradigm for trying to work through it and manage it. And so it's tremendously helpful for people to understand that they're not alone, that they're not the only ones that are going through this, that other people have breakthroughs and other people have struggles. And so it's an important part of our practice here to be able to connect people in that way and give them exposure to other people who are going through similar type illnesses.
So what is happening in these groups? Because I imagine someone, let's say with fibromyalgia, they're expecting medical treatment. And you're like, let's put you in this group. What are they getting?
Yeah, so it's different than it once was. And when I was at the hospital, it was all comers. I was at the Integrative Medicine Center. Anybody who wasn't feeling well, looking for a different approach, would come in, and be my job to kind of get a sense of what they were looking for. And not everybody was looking for a group. Not everybody was looking for me to ask them about past stressors. And so I would try to do what I could given what people were coming in for. Now that it's my own practice, people have a better sense of what I do and how I'm going to approach it. And so a lot of people come in not looking for a medication for their pain, or they've tried them all and they're looking for something different. And so people, at least here, end up in groups because they want to end up in groups. Nobody sort of gets forced or unexpectedly goes in that direction. The groups have taken a lot of different forms over the years, from as simple as like, let's just get together for an hour. Why doesn't everybody tell me what's going on and what's working and not working? And so that's a little bit like individual appointments with observers in the room. Now it's all done online. Initially, it was done in person. But that just gives people a chance to talk and hear what I say to them and hear what I say to the other 6 people who are in the room. These days, there's a lot of specific topics and information that I try to get out to people. When we're talking about the brain sensing danger, it's sometimes that danger is in how we think. And so the more negatively we think, the more catastrophically we think, the worse the pain is going to get. And so we'll do instruction about how to limit catastrophic thinking. Emotions, I think, are scary to many of us. And so if you grow up in a family where anger is not allowed as a kid, kids are really smart. And so they don't have to be told more than a couple of times, don't get angry, before they realize they need some other strategy. Migraine headaches and stomach aches are really good ways to deflect anger when it's there. And so we'll have some instruction about how to deal with anger or sadness or guilt or shame, and then let people talk a little bit about the experiences, do some exercises. At the moment, this has been really fun, actually. We're working through a curriculum in positive psychology, and so focusing on joy and excitement and love and self-care. And people have really enjoyed it. It's not something that we talk very much about in our society these days. There's a lot of negative bias. And so to let people experience those feelings and encourage those feelings and look for those feelings, it's been really helpful, I think, for a lot of people who've been there.
I know it's very helpful for me,
Yeah.
the role of positive psychology, and it's what I do with a lot of my clients.
Yeah.
So I'm wondering if you could talk a little bit about the role that spirituality played, maybe even in your journey, and how you incorporate it or talk about it to your clients.
Yeah, I think that, when I look back 25 years ago, it there was I was trying to get into medical school, or trying to make the decision about going to medical school. I was dating my wife, Lisa, who has since we've gotten married. And sort of as part of that, she and I were different religions, and I was having somewhat of a spiritual crisis all at the same time. And so I think any one of those issues I would have been able to manage, but all 3 of them at the same time was too much for me at the time. And so I think that's why the physical symptoms were so profound. The spiritual aspect, and so I was raised in a secular Jewish family. She was raised in a significantly Christian household, and religion was part of her life when I met. It was not part of mine. And so I started going to church with her, and no one was more surprised than me that I enjoyed it. And we're these days part of a fairly progressive church, and so I feel the need, especially these days, to qualify that a little bit in how we think of our religion and faith and spirituality, but informed a lot by the need to love our neighbor and love our enemies and take care of the sick and take care of the needy, and which I think are a lot of the messages in the Bible that get lost these days. There are other messages, or maybe not even messages, that get focused on that I think are not as helpful for people. But I think it was my conversion, ultimately my baptism, I think was fairly surprising for a lot of my friends who knew me as secular, certainly agnostic, potentially. And one of my really good friends, I remember him commenting that it actually did make a lot of sense to him, that he had always known me as somebody who was curious and interested in mystery and understood the role of a higher power. And for him, it was less of a leap than I think a lot of people who didn't know me quite as well. And so I think the concept of faith is important to me. I think that there's a lot that goes on that we don't know and can't understand. I think within my family, potentially my mother, there's some ability to kind of see things that other people can't necessarily see, or know things that other people don't know. I remember one year, trying to think if it might have been Passover. Our family was over, my family, and then family from Wisconsin who had come down for the day. And my cousin had spent a year in Israel, also sort of raised as a secular Jewish family, not particularly religious. And he came back, and we were talking about politics, talking about religion. And I just understood in that moment he was going to become a rabbi. And so after dinner, I was talking to his brother. The two of them are super close. And I was like, Dan's going to become a rabbi. And Andy was like, no, 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 he's not. And so he announced probably 6 months later that he was going to rabbinical school. And so this idea that and I think many of us have these abilities and skills and empathy to kind of understand the world around us in ways that are often hard to articulate. I have a lot of patients over the years who have a lot of skills in that area, whether you want to call them empaths or clairvoyant, or um, and and it's really disconcerting for them. One of my colleagues has a story where she says she remembers being maybe 8 years old and being at a family party and feeling super angry. And she's like, gosh, why am I so angry? It's a family party. It's really fun. And she's like, oh, it's Uncle Ted in the corner. He's always angry. I'm feeling Uncle Ted's anger. And that was the first time that she understood that she could feel other people's feelings for them. And so I try to be really open to those possibilities, whether it's within my own faith and faith background, or talking with patients about their faith and what's important to them. We're talking earlier about health crises as spiritual journeys, and I've had 3 of them now, and I've learned incredibly important things through them that I wouldn't have learned any other way, I don't think. And I've heard countless patients tell me that in the end, they would not trade this illness, even if they could, that they've learned things from it. It's brought them places that are important. It's helped them really clarify what their role is in this world, that it's taken them into places that they wouldn't have had the courage to go to in other ways. And I've heard that message over and over and over again. And I tell people, like, it's really hard to see when you're in the middle of it. And so sort of when you're really feeling sick, it's hard to keep and hold this idea that, like, someday this will be worth it. But in the aftermath, I've heard so many people say that even if they could turn it back, they wouldn't trade it in if they could.
I've heard that quite a bit as well of, that's the shaman's journey or the healer's journey
Yep.
is they end up going through this big old crisis,
Right.
and then they come out on the other side a
Yeah.
completely different person. And that was the purpose of it. And as you said, it's really hard to see that when you're in it. And I don't
Mhm.
think there's even point in trying to see that when you're in it, because you just need to get through it. And it's
Yeah.
when you can come out, you can look back and go, oh, yeah, that would not have happened had I not gone through that. And yeah, they wouldn't change it. So I do also agree that, an illness is the path to a spiritual awakening
Right.
or significant personal growth. And,
Yeah.
one doesn't have to be religious to accept that. I do not consider myself religious,
Mhm.
but I mean, although I was raised in a very very Christian household.
Mhm.
But I do consider myself more spiritual, and it's because I've gone through my own things as well and come to accept that I am a highly sensitive person. I do know things I shouldn't know. I see things I should not have seen when I was never in the room.
Yep.
Like I hear things,
Yeah.
and I actually like, who is doing the speaking, right?
Yeah.
When you ask a question. And
Yeah.
I do consider myself an intuitive healer,
Yeah.
because I've been through the healer's journey, still in it, but I've worked with patients where suddenly I touch them as a physical therapist and I can see the
Mhm.
thing that brought them in. And now I'm asking them, and they're like, oh, yeah, that happened. And I'm like, why? Where
Yeah.
did that come from? Why was
Yeah.
I able to see that or know that? But it's just part of the journey. And the more I accept it, the less struggle and
Mhm.
illness I experience.
Yeah, for sure, for sure. And the more useful it is to the people who you are working with. And, Rachel Remen, who wrote Kitchen Table Wisdom and My Grandfather's Blessing, which is about spirituality and healing, I've heard her say that in past civilizations, nobody would trust a healer who hadn't had their own health crisis. Like nobody would trust somebody, a physician or a healer or a practitioner who hadn't been sick at some point, because they would have just thought, like, what do they know about getting healthy if they've never done
Right.
it?
Part of the journey.
Sounds.
Just
Yeah,
is.
yeah.
Yeah. And then I wanted to ask you too, like what is your ideal team? I will suggest to my patients that they need to gather a team of people who they're working with. And, when they come to me, I'm part of that team. So I'm the holistic physical therapist that they're working with.
Yeah.
And I will make recommendations as needed if they need someone, but everyone kind of maybe needs a different team. But what is your like ideal team of people that your one client or group of clients will work with? I know you mentioned psychologists already.
Yeah, and I think what you said is important, right? Everybody's an individual, and so everybody needs somebody different. And so nobody's going to have the same team. Me being me, I'll often say that the ideal team are people who are supportive of the patient and help them move forward in their journey. I think that ideally people are open to what we've been talking about, that healing comes from many places in many ways, and are able to look past their specific role. And so I've had my patients work with psychologists not on our team who say, like, you shouldn't be doing, like, I've told you, you have to come to accept your pain and you shouldn't be looking for solutions for it. And so people who are not encouraging of healing, I think, are oftentimes not great team members. We have here, we've got, like I said, 4 psychotherapists who work with people on the psychological side. We have a physician's assistant who does a lot of somatic therapy with people and help them get in better touch with their bodies. We have a health coach who works with people on nutrition and diet and exercise. Um, but healers take all forms. And so physical therapists frequently are part of the team. And I've seen chiropractors be an important part for people, and acupuncturists and Chinese medicine practitioners. Naturopaths can be really useful in terms of figuring out which herbs and supplements and vitamins are useful. I think one thing that I keep an eye out for is that in the conventional medical system, everybody's considered sick always. Like that's how the system works. You have to have a medical diagnosis in order to bill insurance for the visit. And so everybody is assumed to be sick. And then you can see billboards say, like, you could have a heart attack. Do you know how to get to your emergency room in the next 10 minutes? And so many messages about how sick we are. That, I think, doesn't end when we get into the alternative medicine system. And so I see a lot of functional physicians who have the same message for people, but just in different language, like, oh, you're so deficient in these vitamins and these foods are so bad for you. And so ideally, I would want team members who can see the health and the power in people and aren't just looking at what seems to be wrong. And so I think that's an important part to look for as people are finding the practitioners who are best for them, being able to see their grace and their beauty and their strength and the healing potential, because it's easy to miss in our society.
It's what you said. Everyone needs something different, right?
Yeah.
I healed through dancing and somatics and breath work, and that's why I became a breathwork facilitator and a somatic experiencing practitioner. And my definition of spirituality might be different than somebody else's. I built an altar and I prayed every morning for God to give me strength, and I tried to connect with nature.
Yeah.
So
Yeah.
and that's one of the reasons Keneal and I do this podcast, is to bring on different practitioners who provide different ways of healing. And it's what feels good to you, taking
Mhm.
your own power back,
Yes. Yes.
not just
Yeah.
agreeing with someone.
Right. One of my favorite books about healing is called Radical Remission. It's a book about cancer, but I think it applies to more than just cancer. And the author interviewed everybody she could find who recovered from cancer when they weren't supposed to. Either they had been told there was nothing that could be done and they survived, or they had been told, take this chemotherapy, and they said they're going to do something different. And the oncologist would dismiss those patients as all of them are one-offs, even though there's a big group of them. But she was interested. So she talked with them and they told her all kinds of different things that they did in order to recover. But there were 9 things that bubbled up in the end. And 2 of them were physical interventions. So changing diet and using supplements. But the other 7 were not. It was trusting their intuition, taking charge of their medical care, enhancing positive emotions, releasing negative emotions, connecting with social support, connecting with a higher power, and being really, really clear on their reason for living. And I think that's such a nice framework, not just for patients who have malignancies, but for all of us to know, like, these are the important parts of our health and our healthcare and our health journey. And so just trusting what we know inside and taking charge of what's going on in our healthcare, those are 2 extraordinarily powerful interventions that people can take.
Thank you for bringing that up. I think that summarizes very well what other medical practices, and I mean outside of Western medicine, sort of emphasizes is that we are a whole person and we have to look at all the things, including our relationships, how we're eating, how we're sleeping, stress management. Have you been outside lately? Breathe some fresh air. Have you touched the ground? Like there's just so many different factors that go into our health. And I think it's great that more and more people are recognizing that. And I guess I just like your opinion on how you feel about that. Do you feel like there's this shift happening in Western medicine? Because we could all talk crap about many doctors we know who've, done us wrong, right? Or our patient or clients who've been done wrong by
Yeah.
the traditional Western medicine. But do you feel like there's a shift happening right now today?
There's definitely a shift happening. When I think about what I do in mind body medicine, the shift is linear. And so when I say that, I say that, like, if I prescribe somebody a thyroid medication and it works well, they're going to tell 5 of their friends, and 3 of them are going to call me, and then they're going to tell 5 of their friends. And so exponentially, when I first got to Chicago, I went from not really knowing anything about thyroid to managing like 1,200 people's medication. Using our psychology to get physically better is not sticky in the same way. And so it's hard to talk about, it's hard to explain. And so people may or may not tell their friends may or may not listen. And so the increase is a lot slower but linear. And so when I was a fellow at the University of Michigan in 2009, Dr. Schubiner and I invited everybody who we could find who thought about this way and practiced what we considered mind-body medicine. And 30 people came to Ann Arbor for the day to exchange ideas and meet each other and talk about this type of practice. And so in 2024, we just got back from Boulder, there were 300 people there. So a tenfold increase over the course of a decade or a little longer. And that's not 1,000-fold and it's not 10,000-fold, but it's not nothing either. And when Curable, an app in this world, opened a Facebook page for practitioners, 3,000 people signed up. And so it's definitely growing. I feel like we're all trying to get the word out. We're all trying to do what we can. We're all trying to spread this. And so that's what we can do. And I take solace in the fact that even if it's not changing exponentially, it's definitely growing and more people are hearing about it. More people are interested. And people are starting to understand too, right? The role of diet and the role of nutrients and organics and pollution. And so there's definitely interest and it's definitely changing. And it's an exciting time to be part of this medical world.
It sure is. So, Dr. Stracks, thank you so much for being here with us today. We really appreciate it. And I'm just wondering if someone wanted to reach out to you, where could they find you?
Yeah, go to our website, cormendihealth.com, and you can hit a button and get in touch with our staff, and they'll tell you everything that they need to know. I'm licensed in a number of states across the country, and so happy to work with anybody who is interested in knowing more about what we do and how we do it.
Thank you so much.
Great.
You're welcome.
Thank you.
Nice to be here. Nice to see you both.
If you'd like to leave us a message or ask a question, please check the show notes with the link so you can reach us directly, or email us at beyondthepelvis@gmail.com.